There are some frequently asked questions about lens replacements, so I thought it might be prudent to go over those just in case you have one of the same questions, which is probable because they are frequently asked. So let's write FAQs. So the first and most common of the frequently asked questions is, does it hurt? And the answer, you can probably guess that I'm going to say no to that. And then why would you trust me on that? But let me tell you why it doesn't hurt so that you can know that it's just one of the things that an attending that I worked with when I was in medical school would always say to patients. He'd be like, "This won't hurt me a bit." And I don't think he realized that only he thought that was funny. No one that he ever said it to. So let me tell you why it's not just one of those "this won't hurt me a bit" type of things. The same thing that makes the eye incredibly sensitive, where you could, if you've got a piece of dust in your eye that's so small you'd need a microscope to see it, it'll feel like someone has poked you in the eye until that piece of dust comes out. You'll tear like crazy, your eye will turn bright red. That's because your eye is incredibly sensitive due to these very, very thin, very sensitive, unmyelinated, that is, that they are naked, nerves of sensation that line all over the front of your eye like a web. And so those unmyelinated, very thin, naked little nerves are also exquisitely easy to numb. So the same thing that makes them so sensitive makes it so that they are numb exceptionally easy with no injections, no needles. I try not to even use the word needle, but there isn't one, so maybe that's worth using it just to say no needle. It just drops. That's all that you need. And then the eye goes entirely and completely numb so that people can't feel anything at all. The only thing that people may or may not feel, and it's about 50-50, is the occasional little bit of pressure. And so anytime someone's going through the procedure, there's probably a half a dozen to a dozen times that I'll say, you may feel pressure here, you may not. Either one is okay. And in general, people don't for most of those things. But just the fact that it's 50-50 on whether or not somebody does kind of gives you an idea of the amount of pressure that we're talking about. It's more that it just goes from there's absolutely zero sensation at all to maybe a light pressure feeling. If anytime you go from zero to anything, it's good to have a heads up about that. So no, it doesn't hurt during the procedure. Matter of fact, if you find someone who's had a lens replacement, you can ask them, did it hurt? And at least if they had it here, they'll say no. So the recovery part to it, which I was going to say the recovery with pain, but that's actually the second frequently asked question is recovery. And so let's cover the pain involved in recovery first. I would say the majority of people for the first 2 hours will say that it feels like the same as if they had a contact lens that was old or something like that. It's really, really rare. Matter of fact, I can't remember the last time somebody said they had pain after the procedure. So sometimes people will have a little feeling like there's a goober in the eye. If you ever had that feeling where it feels like you've got a little piece of mucus there. But most of the time people just are, I think it's because people prepare themselves for it to be really intense for recovery, to be really hurting for a couple of hours afterwards. And so by far the most common comment that I get on the day one post-op is when we're seeing people the next day after is that they felt surprisingly great for the whole afternoon. They'll say, I went to lunch and things were fine. But as you can imagine, that varies from person to person. Everyone has different DNA, but I would say that the majority of the people, the bell curve falls within the recovery being either nothing at all or mild to the point that it's surprising. Now, as far as recovery goes with activity, what can I do afterwards? Can I go to work? Can I wear contacts? Things like that. That one comes up a lot. People really like their colored contacts. But the answers to a couple of those questions, we see people the next morning after to make sure that everything looks good. And then once it does, people are free to return to their normal activities, except we don't want people to do heavy lifting. And so the way I describe that to people is don't try to pick up your car in the first week. Anything that weighs more then a gallon of milk, or maybe if you're a big strong person, a gallon of milk in each hand. Anything that would require you to make a Valsalva type of noise, we tell people to hold off on that for the first week. Between you and me and the video camera that I'm looking at right now, I have not yet seen a case where somebody caused damage from pressure. That's not to say we want you to pick up heavy things the first week, but there is some leeway there. It's not like people have to lay perfectly still or sit in a recliner, because most people forget and tie their shoes at some point and bend over and grunt, and then they're very worried. But it always looks great. So the other part with recovery is for swimming. People ask that a lot. We don't want people to swim around with their head underwater for a week. After that, it's fine to be in a pool. We don't want you to get a bunch of water splashed into your eyes for a couple of weeks after that. But the recovery in general is really, really mild. Things like light cardio, riding a bicycle, going around and working on your short game in golf, next day is fine for those types of things, which is surprising to people. But it's also microscopic with what we're doing, that the recovery is really, really fast. And then this one comes up a lot. Should I wait? And the thing that people are asking about specifically on this one is, should they wait to get cataracts? It is a personal choice. There's no right answer, but I can tell you what my opinion on that is, because that's what people I think are asking for when they ask this question. If someone has the means to do it, I feel like there's not a lot of value to remaining more handicapped than you need to for a longer period in your life. And so I would feel differently about that if it was, hey, we can get you 20/30 level vision if you do this now, but we can get you to 20/20 if you wait a little bit longer. That's not how it works with this. We get this maximal vision for the eye, and then it stays that way for the rest of their life. And so there's two different ways to do it. One is to let your vision get worse and worse and worse until you feel like there's a disability there. And the other one is to nip it in the bud and not let it get worse, and then have good vision from that point on. And so there are people that have a whole extra decade or two with glasses-free clear vision because they had lens replacement, and you never go on to get the cataract. It never happens because you fixed the problem before it ever started. There are reasons to wait, and some of those might be financial, some might just be that people need to do a little bit more research to feel a little bit more comfortable. I encourage people to do research and to do this no sooner than they are ready, but also no later than when they're ready, because it's a genuinely miraculous thing for people after they get through to the other side.